Hello, it's Dr. Rhonda Johnson, and today is Wednesday, September 23rd, 2020. You know, chances are you've heard the term or the phrase long haulers, right? And if you haven't heard it, you've probably heard it recently. Well, prior to this pandemic, we might have conjured up an image of someone driving an 18-wheeler truck. Well, think again. For tens of thousands of people now, collectively known as long haulers, are people who have survived COVID-19. Now, these aren't people who were severely ill in the hospital for 3 to 4 months and on a ventilator. These include people who've had the very mildest of cases. And basically, this term long hauler refers to people who have recovered from COVID-19 and who have been suffering for months with unrelenting and many times unpredictable symptoms. Now, just in case you think these are people who are elderly with a long history of pre-existing conditions, think again. Many of these long haulers are young people under the ages of 40 and previously healthy who were living a healthy life prior to becoming infected with COVID-19 during this pandemic. Now, if you listen to a certain political leader, you would be inclined to believe the idea that COVID-19 kills a, quote, few elderly people, end of quote, and is mild and has no symptoms for the rest. But doctors are saying that this is clearly not the case. Although at first, many doctors did not believe what their patients were telling them, and the patients had to convince their doctors and do their own research to prove that this was really a true finding and that their symptoms were real. Now, one public health epidemiologist goes as far as to say that experts and officials should stop referring to all non-hospitalized cases as mild disease. This epidemiologist has suggested that we redefine recovery from COVID-19. And she said that recovery from COVID-19 goes beyond being discharged from the hospital or testing negative for the virus and should account for a patient's quality of life. This epidemiologist said death is not the only thing that counts. We must also count the number of lives that have been changed. Now, many long haulers, now this is not everyone, suffer from prolonged shortness of breath, even when their oxygen levels are normal. Others have irregular heartbeat. Some suffer from severe muscle weakness and muscle fatigue, similar to chronic fatigue syndrome. Others suffer from chronic headaches, the sensation of having clogged ears, various disorders of their skin, scalp. Some suffer from severe dizziness. And then there's the whole, what's called central nervous system syndrome. And that can include dizziness, difficulty concentrating, memory loss, chronic loss of smell, changed sense of taste. And there are lots more symptoms. Now, many of these so-called long haulers may suffer with these problems for a very long time. Nobody knows just yet. What is known is that on autopsy studies of people who have died from COVID-19, the findings have included evidence that's indisputable of damage to the blood vessels, lungs, kidneys, heart, intestinal tract, and the brain. Some people who have lived have lost their limbs. Now, COVID-19 is not just a mass killer. It might just end up being the most common cause of mass disability in the hundreds of thousands of people who recover from this pandemic. Getting this pandemic wrong has not only been deadly, it's been extremely harmful for people. COVID-19 presents new challenges, new medical problems for many who have recovered from this today, and who knows if these problems will continue for years to come. So my point of having this discussion today is so that people will not be fooled. Don't believe what you're hearing, especially our young people. This disease has a lot of ramifications. Many people are suffering in many ways. This pandemic has wreaked a lot of suffering throughout the world. Please feel free to share this message and continue, please, to do everything you can to stop COVID before it stops you. As always, my views are my own. My only intent is to help save lives, and I will add to help stop suffering today. Stay safe, stay connected, folks. Stay well, and continue to prevent COVID-19 by practicing the 3 W's. Wear that mask, wash your hands, and watch your distance. Have a blessed day.